Knee replacement is recommended when you have pain or a patient has a pain and they can't walk, sleep, and the quality of life is disturbed. That would be the right time. Early knee replacement is not a good idea because the success rate is about 80 to 85% of patients where patients feel that surgery was beneficial. So significant pain affecting the quality of life would be the right time. And knee replacement certainly can change patients' life. They can sleep better, walk better, and the quality of life improves. And that is the reason that it is recommended and is a highly successful operation. So in short-term, recovery can be difficult for patient as it's quite a painful operation. And usually patients stay in hospital for about 2 to 3 days and subsequently some will need physiotherapy, some can do exercise at home, but it can be difficult procedure in terms of walking, pain. But most people in shorter term, by 6 weeks to 12 weeks, are pretty good, mobilizing, quite happy they get it done, they had the surgery done. A lot of patients in a post-operative period get so much pain they feel it was a bad idea to get it done. In fact, that's not true. In long term, they recover and they're quite good. Some people can take a longer recovery, and the maximum recovery can take up to a year, but most patients by 6 to 12 weeks are pretty good, and it is a life-changing operation for most patients. A total knee replacement is a very successful operation, and I always put it to my patients that if I do 100 knees today, 90 of them should last about 20 years. Rest can fail in 2 weeks to 2 months to 2 years to 10 years. It's hard to say. And so this is quite important from patient's point of view, that they can last pretty long if successful. So the cost of knee replacement is based on the prosthesis, because you need to use prosthesis, which is quite expensive, then the hospital stay and surgeon's fee, anesthetist fee, and the theater costs. So there's quite a lot of costs involved, and the total cost varies from hospital to hospital, and they vary between 10 to 13,000 pounds as a whole, and it's quite variable in the type of the hospital and which part of the country you are in.